According to the CDC, black women are 3 times more likely to die from a pregnancy-related cause than white women.
The CDC also says multiple factors contribute to these disparities, such as quality health care, underlying chronic conditions, racism, and implicit bias.
For Black Maternal Health Week, 9 on your sides, Adriana Hargrove spoke to doctors and officials today. Adriana, what are some of the ways they're addressing this crisis?
Ken and Angie, the NCDHHS are implementing ways through various programs to address maternal morbidity and maternal mortality amongst black women. And health officials with ECU Health say they're connecting with patients to learn their needs and wants.
We do see that in the western part of North Carolina, those numbers are greater. And when we look at the western part of North Carolina, that region has been impacted by hospital closures. That region has been impacted by access to care. So women there have to drive further to access, let's say, high-risk maternity care.
Officials with the NCDHHS say they have a network called the State Provider Support Network, which is a team made of an obstetrician, family medicine doctor, a pediatrician, and a nurse. This team looks at how to improve black maternal health and prevent maternal deaths.
When we look at maternal deaths, the data shows us that most maternal deaths occur within the first 42 days after birth. And so what we want to make sure we do is ensure that women know how to transition their care and then have up to a year to be followed by a primary care provider, and ensuring that their children too are being followed by pediatricians.
Courtney Strickland, a clinical assistant professor in the obstetrics and gynecology department at ECU Health, believes diversity can help some of the health disparities black women face when it comes to maternal health.
I do think that it's easier when you have a staff of various backgrounds and races and genders and opinions and thoughts. You're able to catch those patients that, maybe this person thinks or acts differently from you, but they might act similar to one of your staff members.
Strickland says the medical field can use improvements on how to connect with patients and figure out their needs and wants.
Listen, just take the time and listen. Try to understand your patient and, their backgrounds, their challenges, what challenges they might have had, coming into the appointment that day.
Now, for more information on black maternal mortality rates and the different programs the NCDHH has, visit WNCT.com. In the newsroom, Adriana Hargrove, 9 on your side.